So my topic for the final paper was about Black people experiencing medical negligence and the possible factors that go into that. I approached it as just your typical research paper, whether in MLA or APA format. So I did make sure not to say that correlation implies causation, and I just tried to talk about the cultural implications and just the history behind it and how it shows up today. So from introduction, I just talked about what people endured during slavery, some of the things that came out of slavery or, enslaved people being treated as human guinea pigs was the speculum used in the gynecologist offices today that was tested and, kind of got the kinks worked out by using Black women who were enslaved. They did not consent, and they did not have anesthesia. There were other things discovered for gynecological progression, such as, I think it was fistulas. They figured that out through the use of slaves. And they also would study Black children's brains and compare it to fully developed adult white brains to justify that Black people were expected to have a lower IQ. They're not as intelligent. They will not be sound if they're off on their own. They need to be enslaved because the white people are the saviors. And so it just showed how far they would go, how willing they were to go to prove and justify slavery and other unethical treatments. So then after slavery, I discussed how there were so many significant experiments that were done to Black people. There was no moral code, there was no ethics involved, and even if there was, they really weren't trying to employ them with Black people as the subjects, such as with the Tuskegee syphilis experiment. And just really knowing that they did not know that this was syphilis that they were injecting, they used the phrase, "Oh, we're treating you for bad blood," which is a blanket phrase that was coined to just say, if you have bad blood, then you're going to be more likely to get diabetes or hypertension, high blood pressure, all of that, which is, commonly seen in Black people today. So they just said that came from being Black, and Black people have bad blood, so let's just fix it. And so naturally, they were misled, and it was actually an infection of syphilis. And I also didn't know that the study lasted 40 years, 4 decades. But penicillin was discovered about 10 years into the study, and they were never given that. I knew that they never got the cure, but I didn't know that it lasted so long. And another fun fact, but not really fun, is that it was funded by the CDC. And that was really ironic to me because, we all want to believe the CDC, we're going by them, or most people are abiding by the CDC regulations and suggestions, such as, standing 6 feet apart, wearing a mask, all of that, and just washing your hands, and, all of the things that we've been doing in the pandemic. CDC has been seen as a very trustworthy source, and it's just crazy to see how it started out. Then after talking about how there has been such a distrust ingrained into the Black community, generation by generation, I can personally say that my dad, he prefers not to go to the dentist. He had a chipped tooth probably when I was like 10 years old, and I'm 21. He just got it fixed this summer because he didn't want to go to the dentist, even though, we have insurance, we have the wherewithal to go, but he just does not like them. And so with my research, I figured out that people don't go to the dentist because they weren't allowed to at first. Black people had to go to the veterinarian to get teeth pulled or whatever else they needed done. And oftentimes, whenever they would be at the vet, they would, again, not use ethics, as they did not have to take that oath to help people at all, because they're for pets and animals. So there are often times where you go in to get one tooth pulled and you come out with like 5 missing because they wanted a souvenir. So after just talking about the background, I was able to study a combination of surveys and meta-analyses that just really asked the same couple of questions to different groups of people. The main one that I saw was a survey about people thinking that Black people have different body parts or they're constructed differently. I've actually had somebody tell me, oh yeah, you probably weigh a little bit more because your skin is thicker. And I'm like, no, it's not at all. So they ask questions to people that are medically affiliated, so medical students and physicians that had been practicing for a while, and then people who are not in medicine at all or healthcare. They asked, do they think that Black people feel less pain? Do they have a stronger body, thicker skin? Yes or no? And I want to say that it was about 40% of those participants that believed that those were true statements, even though all of those statements have been disproved by plenty of different experiments. Also, with other polls, there was a poll on National Geographic that compiled about 777 different Black participants' feelings about the medical field and just times of discrimination from, the first time that we got on lockdown up until now, because it was published in October of this year. It just talked about discrimination as a whole, and then going into how does it feel to be Black during this time specifically, during 2020. And it asked about how likely you are to take the vaccine whenever it comes out in a larger amount. And about 50% of the 777 people said that they would not be likely to take it. So that just told me that there's really no trust there for the medical field when it comes to Black people, because there's so much that is shown that, proves that you don't really care about Black people. A man who was in his 70s in that same article said that whenever he goes to the hospital for whatever routine thing he needs, he can always watch the nurses run to the aid of white people, but really just have a nonchalant and indifferent kind of attitude towards Black patients, which he said, that's how the start of the country was, and that's how it's going to be until the end of this country. So he doesn't even believe that there is a positive outlook or something good that can come out of it. And then lastly, before I wrapped it up, I just talked about the prevalence of maternal mortality rate like I wanted to initially in my abstract. And certain things like the prevalence of pregnancy-related complications and the mortality rate, there's a ratio called the PRMR between ethnicities and races. And Black women's was the highest. Per 100,000 live births, there's a ratio based off of that. So Black women's was the highest at 40.8, and then white women's was at, I want to say 12.5. And then the second highest was for Indigenous women with about 29.7. So they just discussed the difference between treatment and what the likelihood of other health issues like preeclampsia, hypertension, what's another one? I want to say, embolism, so pulmonary embolisms. And then I discussed how Serena Williams actually had a pre-existing pulmonary embolism, which led to her having a coughing fit, which opened up her C-section scar and created blood clots in different areas. And whenever she tried to get a CAT scan, the nurse shrugged her off and said, oh, you're just delirious from your pain medication, you're fine. And she almost died. Same thing with Beyonce. Whenever she was pregnant with her twins, she had to have an emergency C-section because she was experiencing preeclampsia, which is something that affects about 3.4% of births in America. So, but it also said in the CDC article that I cited that Black women are more likely to experience preeclampsia than anybody else. So it just showed me that there's a lot of inequities in the healthcare field, even more so. I knew that before, but to really see all of the different articles at once, it just showed me that it's deeper than you would even think at the surface level. So I had a good time doing this paper, and I've enjoyed this class so far. Thank you.